Hi, good day everyone. My name is Ariel Herrera and this is my FMA 2 Part 3 video presentation on the Healthier SG campaign. This will evaluate the campaign reported by Mr. Joseph using the adaptive framework. The video highlights the strengths and gaps of the campaign with a corresponding scorecard for measurement purposes. Let us begin. Let us now look at the Healthier SG campaign using the Analyze lens from the Adapter framework. For the strengths, the Ministry of Health analyzed the needs of over 6,000 residents. This showed that it was not just a government idea, but also addressed the pains such as high cost of medication for chronic diseases at private clinics. Also, just to note, the visiting to the hospitals or clinics were mainly transactional, meaning patients only went there when they were feeling sick. And also analysis and rollout was done in waves with those from 60 plus age groups first, then after goes to the 40 to 59 age groups. Also analysis on the IT gaps between private clinics and national hospitals were done, and this led to the creation of the NEHR, or the National Electronic Health Record Integration. For the gaps, there was an invincibility barrier by young adults who were below 40 or feeling of being healthy and invincible. They were harder to convince to enroll in a preventive plan today for a benefit of 20 years from now. And also the GP administrative burden or fatigue that doctors feel when they migrate to new IT systems. This could possibly affect actual patient care. For this, the campaign receives a score of 4.8. Let us now go through the Healthier SG campaign using the Define Objective lens. For the strengths, instead of just saying we want people to be healthy, the government set precise targets. For example, they aimed for 95% coverage of private GPs to join the network and targeted the enrollment of all residents aged 40 and above by 2024. Also, the success of the campaign was defined whether a resident had a single personal health plan and a long-term relationship with one family doctor. There was also a shift in the doctor's KPI from treating an illness to preventing one. And also the objectives were tied to clear financial goals, making chronic medicine prices at private GPs comparable to polyclinics. So this removed the cost barrier that previously prevented the people from choosing private family doctors. For the gaps, the campaign focused too much on the number of people who signed up rather than the actual health improvements that were achieved. Also, there was less clarity on whether residents actually trusted the doctors more or because it was actually cheaper. And lastly, there were lesser defined objectives for those aged from 20 to 39 age groups, and this created a wait and see gap for the younger generation. For this defined objectives, the score for Healthier SG campaign is 4.7. Let us now go through the Assess the Materials lens for this campaign. For the strengths, before the mass rollout, Ministry of Health had a listening tour with over 6,000 residents. This acted as a massive pretest for the concepts behind the campaign. For example, they tested how people felt about health points and incentives, leading to the refinement of the Health 365 app rewards. Also, the campaign didn't just do one test poster. They tested different messages for different age groups, seniors versus middle-aged adults, and across multiple languages. So this helped ensure that the Healthier SG brochure was as clear in Mandarin or Malay as it was in English. Lastly, the Health 365 app underwent significant beta testing to ensure that seniors who were not tech savvy could navigate the enrollment process and track their steps easily. For the gaps, early feedback suggested that the information had an overload and that some residents found the tiered benefits confusing. The materials were sometimes criticized for having too many terms and conditions. Also, the technical manuals provided to the general practitioners were extremely dense, with some doctors reporting that the onboarding materials were too complex. And also, the pre-testing focused heavily on whether people understood the steps to enroll, but less on whether the materials actually inspired them. For this, the campaign receives a score of 4.2. Let us now look at the campaign using the plan or strategized lens. For the strengths, the strategy was not a one-day launch. It was planned in waves and started with seniors who were aged 60 and above, and they expanded that to the 40 to 59 age bracket. This phased rollout allowed the system to manage the workload without crashing. Also, the plan addressed the cost barrier head-on. By strategizing to make chronic medicine prices at private GPs comparable to polyclinics and offering free health screenings, the plan removed the biggest reasons why people avoid the doctor. The plan also strategically utilized the three regional health clusters, the NUHS, SingHealth, and NHG, to act as central supports for smaller private clinics, sort of a hub and spoke kind of support system. This ensured that even a small mom and pop clinic had the backing up of a major hospital system. The strategy also smartly integrated the Health 365 app and Lumi Health using health points as a nudge to reward residents for small actions, like going for a first consultation or hitting a step target. For the gaps where the logistical plan is near perfect, the human resource strategy faces a massive challenge. There is a strategic gap in how to rapidly increase the number of family physicians and nurses to meet the new demand created by the campaign. Also, a core part of the plan relies on the National Electronic Health Record, the NEHR. The strategy assumed all private clinics would transition smoothly, but some legacy clinics still struggle with the technical requirements, creating blind spots in the digital plan. And lastly, the current plan is very senior focused. There is a perceived gap in the strategy for preemptive enrollment for those who were in their 20s or 30s, and they were actually the ones who were most likely to benefit from prevention decades down the road. Still, the campaign gets a score of 4.9. Let us now look at the Healthier SG campaign using the transact or implement lens. For the strengths, as of early 2024, over 700,000 residents had already enrolled in Healthier SG. The onboarding process via the Health Hub app has been relatively smooth for most of its users. And also, one of the biggest implementation wins was getting private doctors on board. Over 1,000 GP clinics have signed up to be Healthier SG clinics, ensuring that most residents can find a doctor near their home. Third, the Kickstart transaction. The government made the first health plan consultation free. This $0 transaction removed the initial friction, encouraging seniors and middle-aged adults to take the first step. Lastly, the government didn't just wait for the people to use the app. They also implemented ground teams, ambassadors who go to community centers and void decks to help seniors enroll in person. This physical transaction is what made the campaign reach the less tech-savvy. For the gaps, because so many people were transacting at once, some popular GP clinics reported longer waiting times. So this implementation stress sometimes frustrated residents who were used to quick walk-in visits. And also, while the Health Hub app works for most of the time, there were transactional glitches wherein people found it hard to link their preferred doctor or view their specific health plan details instantly. And lastly, for the doctors, transacting Healthier SG involves a lot of data entry into the National Electronic Health Record, or NEHR. Small clinics with limited staff sometimes struggle to keep up with extra paperwork while also treating patients. Still, the campaign gets a score of 4.5. Let us now look through the campaign using the evaluate lens. For the strengths, as of 2026, the campaign successfully enrolled over 1 million residents. So this shows that over 90% of seniors support the initiative, and more importantly, over 70% of those enrolled are using the services for annual screenings. Next, the Healthier SG uses a care report system in the NEHR, or the National Electronic Health Record. This allows the government to evaluate clinical results across the whole country in real time rather than waiting for paperwork. And lastly, a major 2026 evaluation win is the rollout of the AI-driven screening, which allowed the system to predict if a patient has a 75% chance of developing a chronic disease in the next 3 years. For the gaps, over 80% of the residents still would opt to see other doctors for second opinions or convenience. So this means that the one doctor relationship hasn't solidified yet. And also, while people are enrolling and screening, the evaluation shows that daily habits like exercise and eating less salt are changing much more slowly. So awareness is high, but real life action still lags behind. Evaluate score for this campaign is 4.6. Let us now discuss the last lens, which is the reiterate. For the campaign's strength, based on the success with the seniors, the 2026 reiteration is now focusing on the 20 to 39 age group. They are also reiterating for children through Grow Well SG, bringing personalized health plans to primary 4 and 5 students. After hearing that doctors were also overwhelmed with paperwork, the 2025-2026 reiteration introduced patient care summaries and self-help report modules for clinics, which makes it easier for doctors to file reports and get paid. And also the campaign is reiterating how it connects people to the community. Instead of just exercise classes, they are now pushing mental wellness circles and I Quit Smoking programs directly through the GP. For the gaps, as the program grows, it adds more layers such as new AI tools, age groups, and subsidies. There is a risk that the campaign becomes more complex so that reiteration actually becomes harder for busy GPs or a regular resident to keep up. The campaign gets a score of 4.4. From the scores gathered, Healthier SG campaign gets an average of 4.58 when evaluated against the adaptive framework. This proves that the government built a rock-solid foundation from the deep research and clear goals to the massive logistical effort of linking private doctors into a national system. This demonstrates three key things. They successfully made it cheaper and easier for the average person to see a regular family doctor. Second, people aren't just hearing about health. They are actually signing up and getting screened in record numbers. Lastly, the high score reflects that the program is smart enough to learn from its mistakes, constantly updating its technology and expanding to help younger Singaporeans before they even get sick. And this wraps up my video presentation on my evaluation on the Healthier SG campaign against or using the adapter framework. Once again, my name is Ariel Herrera. Thank you very much for watching my video presentation. Till next time, goodbye.